Well, of course, we would meet and greet you and everything, and you know, no good office can operate without their paperwork. So, of course, there's an in-depth questionnaire that finds out about your medical and dental history, and also what habits you have, what's been your past experience. And then there's a section for the jaw joint, anything going on there that you're concerned with, headaches, earaches, things like this. Then after we enter that information in the computer, that person comes back, I sit down eye to eye, knee to knee with them, and we have a conversation. Now keep in mind, I've made the appointment with the patient. They've called me on the phone. This is personalized dentistry. So when they're interested, a new patient always talks to me first on the phone. So I find out what they need and want, what they're interested in, to make sure they fit with the philosophy. Because some, it may be they're just looking for a dentist to go to throw a crown on a tooth, and that's all they care about, and you know, does my insurance do this and the other thing. Whereas mine is the more holistic, whole mouth approach of health. So now by the time they come back in the room, I already know what it is that they need and want, but we review it just to make sure we have everything. Then once they've told me that, I lay them back and I enter all the treatment they've had done in the past, in my computer model, and then we check their gums, and then I check all the different muscles of the joint, and I check the wear patterns of their teeth. Everybody has a history on how they chew and grind and rub on their teeth, etc. And the history that they have is reflective in the wear patterns on their teeth. Now the importance of that is that if I'm going to restore that person's mouth, I have to incorporate that pattern in, because it's not going to stop because I've rebuilt some teeth. And this is a factor that gets missed a lot, and so then people have something restored and it breaks over and over again. So we minimize that. So now I've checked their teeth. After I check the wear patterns on their teeth, then I check all the soft tissues and I make sure everything's healthy there, sort of an oral cancer type screening of everything. And then I sit them forward, I do my photography, so I have a picture of all their teeth, their mouth, their smile, their profile, all these things, and then we get any needed digital x-rays, and that would conclude the proprietary exam. It typically takes an hour and a half to do that. Now, there's an added element for those people that have severely worn teeth or multiple missing teeth and the bite is challenging. I would also take models of their teeth at that time that's mounted in a certain way in my laboratory so I can study all these things. That would then conclude the exam. Meanwhile, behind the scenes now, I'm going to study all this data that we've gathered, and then they come back for a treatment plan presentation. It's extensive. Well, the traditional dentistry, the model is set up, and people will do this. I need to get my teeth cleaned, and I should probably get an exam too. So they schedule them with the hygienist. The hygienist does the cleaning, or maybe the doctor does the exam, but it's a fast exam, 10-15 minutes, to quickly get them over to the hygienist. And meanwhile, the hygienist cleans their teeth, and then at the end, the patient's given, I call it a grocery list. They're given their grocery list of everything wrong with their teeth and how much. And sometimes the doctor goes over it, but sometimes it's an office manager or someone else. And that's been people's traditional experience going to the dentist. That's not what we do in my office. I talk to them on the phone before they make the appointment. I see them when they come in, and then I see them the next visit. There's no added fee for me to see them on the second visit to go over their treatment plan. And the treatment plan I go over with them is based on me showing them their photos and showing them the problems that are there. But I also point out what is right in their mouth, what they've been doing that's right, because that's very important on how we build their health long term. Because we want to accent what they're doing right and keep that habit in, or that procedure they're doing in. And then I'll go over with them based on what they say. I'll go over them what the treatment is that we've agreed to with my recommendations, and then I'll go over the cost and all those things. And I do this before we start any other procedures, so they'll know everything before we do anything.